Good morning, everyone. On behalf of the National Disability Authority, I am delighted to welcome you all here this morning to the launch of our report, Lockdowns Unlock Innovation, a review of innovations and adaptations affecting persons with disabilities arising from COVID-19 restrictions. As many of you know, I am the Director of the National Disability Authority, and our mission is to provide evidence-informed advice to government on matters related to disability and to promote universal design. I am a white female with shoulder-length brown hair, and this morning I'm wearing a V-neck black blouse with some pink flowers on it. I want to start by explaining why we decided to undertake this project. There has inevitably been a great focus on the loss, damage, and negative impacts that COVID-19 has brought. But through our work on various committees, and by talking to persons with disabilities, members of DPOs, and many of our stakeholders, we have heard anecdotally that some of the developments that had come about as a result of COVID-19 restrictions, in fact, brought positive changes for persons with disabilities. A willingness and an appetite for rapid change is often a feature of crisis periods, and this was indeed the case during the pandemic. In fact, some of the innovations have accelerated changes and advances that are welcome to the disability sector. We wanted to collect evidence of these changes and document some of the positive innovations and outcomes for persons with disabilities. Ultimately, we wanted to be in a position to share the learning across the disability sector and highlight some of the positive developments arising in response to COVID-19 in the hope that these could be retained following the pandemic. This report would not have been possible without the submissions from people and organisations across the disability sector, and I would like to thank each and every contributor to this report for the time they took to get in touch with us and tell us about their experiences. The authors of the report note that each contribution was used, so sincere thanks to you all. And the report was also informed by information we gathered during an event arranged in May to hear directly from persons with disabilities, including through their representative organisations, about innovations and developments arising as a result of the pandemic that had impacted their lives. At today's launch, we will hear directly from persons with disabilities about some of the innovations that they had personal experience of. I'd like to thank all of those that contributed or are presenting at today's webinar for giving so generously of their time and for their support and assistance. I'll now just give you a quick sense of how the rest of the event will run. Our research officer, Cliona Doherty, one of the report's authors, will run through a summary of some of the report findings. And the report's other co-author, Senior Research Officer Caroline O'Nolan, will then talk us through the format for today and introduce the various contributors. The final report will be uploaded to our website after this event, accompanied by an easy-to-read version. I hope you find it a useful resource and that you are able to use it like a directory of innovations and adaptations of work practices that have occurred since March 2020. Although, of course, it cannot be an exhaustive guide. So if you experience other innovations that you'd like us to know about, we're always pleased to receive this information. I hope you'll find it a really interesting and helpful event, offering an opportunity to learn from the experiences of other stakeholders and how they adapted to combat the COVID-19 restrictions. And without further ado, I will now hand you over to Cliona Doherty to present a brief overview of the report and explain the lineup for today's event. Thank you very much.
Thank you, Aideen. My slides are just going to be shared now in a moment. As Aideen said, my name is Cliona Doherty and I'm a research officer with the National Disability Authority. I have shoulder length hair that is brown and blonde in different places. I have blue eyes and I'm wearing an animal print shirt with one of my favourite necklaces. It has a silver chain and a green stone. Today, I'm going to run through the main findings from the study and then hand over to my colleague Caroline, who will talk through the format for the event and introduce the speakers. First, I wanted to provide some background as to why and how we completed this piece of research. The study began by issuing a call for submissions across the disability sector, seeking examples of changes that have come about as a result of COVID-19 restrictions. We particularly wanted to document the new practices that may stay in place as they are deemed a positive and helpful change. We were delighted with the response to our call, as we received in total over 30 submissions, including 28 written submissions. We also supplemented the research we received with desk-based research and reached out to those involved in initiatives that were of interest. The NDA held a consultation earlier in the year, as Aideen mentioned, called Building Back Better, which heard directly from persons with disabilities on the positive developments arising in response to the pandemic. This consultation has also informed some of the analysis in this report. The final report categorizes the findings into 9 areas, and the report is structured around these areas. These are social, cultural and community life, education, employment, specialist disability services, health services, mental health and wellbeing, family carers, sports and exercise, and universal design and accessibility. Each section of the final report begins with a consideration of the impact of the pandemic on that sector. This is followed by a review of the innovative practices and adaptations identified by the relevant stakeholders. Case studies in each section outline specific innovative responses, and each section concludes with the main challenges and opportunities in that sector. So I don't have time today to go through the findings from each section, so I just wanted to run through some of the overall findings. There has been an increased use of technology across most sectors. The examples in the study illustrate the prominent role that technology can play in the lives of persons with a disability, and more importantly, the capacity people have to engage with it, which our report points out appears to have been underestimated in the past. It's the next slide there, please. There is still space for further innovation and adoption of technology, but it is likely that in the future, assistive and information technologies used in conjunction with the internet will play an even greater role in enabling persons with disabilities to undertake everyday tasks. An additional benefit of the shift to online services and the increase in the use of remote platforms is that it has uncovered the potential for alternative approaches to service delivery and information sharing. It may provide a route to greater levels of efficiencies by enabling resources to be more widely shared. The submissions received suggest that there is an appetite among service providers and their clients for some changes to be embedded and further developed. A blended approach that incorporates a mix of in-person and remote services is now a viable option for areas such as specialist disability services, therapy services, support services, and some education provision. However, the report highlights that reliance on online delivery could have the potential to exclude those with no access to digital technology or poor broadband connections. And COVID-19 has heightened awareness of the need to address inequality in access to digital technology and combat digital poverty. Equally, the pandemic has brought about changes in the way we work, which may be sustained in the long term. Remote working has the potential to alleviate some of the barriers to entry and retention to employment for persons with disability, and already has to some extent, as a speaker at the NDA Building Back Better consultation termed, level the playing field in terms of employment opportunities. Technology will play a central role in sustaining this. However, the examples in this study also illustrate the importance of communication and staying connected to ensure workers feel supported. And there can be no one-size-fits-all approach to improving employment outcomes for persons with disabilities. In education, we all know the school closures were far from ideal, but the report demonstrates that new avenues and opportunities for learning have been found in some instances. Online delivery has ensured that a wider audience can access resources. It has been pointed out that the option of accredited grades can be especially beneficial for students with disabilities who may find examinations particularly tiring and stressful. The summer teaching programme has replaced the supplementary teaching provided in the previous years, often referred to as July provision. Eligibility for inclusion in the programme has been widened for summer 2020 and 2021, and the programme may address some of the gaps in learning attainment that may have emerged due to school closures. The pandemic has also ignited considerable innovation in the med tech sector. The devices and apps developed may also contribute to more efficient and effective care and enable patients to be more engaged in the management of their conditions. This is likely to be especially beneficial for persons with chronic health conditions. Equally, the use of telehealth has taken root in the Irish Health Service and is now firmly established. Accessing healthcare is now more convenient and less tiring and costly for some. If continued, telehealth may result in more effective and efficient clinical services, which can be more easily accessed by patients. These are advantages that may be particularly pertinent for persons with disabilities. It's unclear how mental health will be impacted by the pandemic. In the long term, we are all aware of the concerns that there will be long-lasting and significant mental health impacts across society as a result of the restrictions in the last 18 months. However, the promotion of awareness and discussion around mental health continues, and we hope that this may help to further reduce the stigma of mental ill health that can still currently be experienced. The study also illustrates examples of cross-community collaboration and increased community engagement. For example, in Galway, local community Gardaí assisted people in the community with technical difficulties. Equally, opportunities have arisen for clients to develop friendships beyond their own service. The study illustrates that many of the new innovative and adaptive practices were led by staff and highlight staff resilience and creativity. As restrictions were put in place to safeguard public health, staff across sectors spearheaded resourceful solutions to ensure connectivity was maintained. New leaders and champions have emerged and collaborative work practices were adopted. As the pandemic eases, there will be time to reflect and put in place systems that can best harness and build on the collaborative spirit that has come to the fore. The study highlights that a considerable effort has been made by national and local organisations to motivate and encourage persons with disabilities to remain physically active. Disability awareness and inclusive practices of local sport partnerships and national governing bodies of sports have improved. This should make it easier and more enjoyable for persons with disabilities to get involved in a range of sports in the future. In terms of the built environment, infection control measures has resulted in improved access to some buildings due to the introduction of non-touch and voice-activated technology, such as automatic doors and automatic soap dispensers, which will hopefully be integrated into new builds. However, the report notes that the reconfiguration of outdoor space may both improve and impede the ability of persons with disabilities to navigate outdoor spaces. Finally, there is some evidence that information accessibility is now more of a consideration than before the pandemic. For example, information on COVID-19 is readily available in easy read, audio, braille, and ISL formats. Overall, the report illustrates how as a society we have the ability to come together and find solutions and respond rapidly with creativity to challenges. I would like to formally thank everyone who helped make this report happen, especially all the people who took the time to send in submissions and shared their experiences of what worked for them and demonstrates some of the positive impacts of the COVID-19 pandemic. I'm now going to hand over to my colleague Caroline O'Nolan, who will run through the format for today's event and introduce the participants. Thank you, Caroline.
So good morning, everybody. My name is Caroline O'Nolan, and I'm very pleased to welcome you this morning to the launch of this report. For accessibility purposes, I'm going to provide a short description of myself. My hair is shoulder length and has been dyed a kind of blondish brown colour to cover the grey. I have blue eyes and I'm wearing a white top with a blue floral pattern. I'm also wearing glasses that help me read and see the computer screen. Today, the ISL interpreters are Shelley and Catherine, and captioning is provided by Karen. We are also assisted by our colleague, Kate Jennings, who is behind the NDA screen. So during today's webinar, we will be showing two pre-recorded contributions. One is from Fighting Blindness, and the second is a collaborative contribution that includes Dublin City Sports and Wellbeing Partnership and the Central Remedial Clinic, or CRC as it's commonly known. We will also have live presentations from the chairperson of Galway Advocacy Council of the Brothers of Charity, Pat Faherty, and from Courtney McGrath from the Trinity Access Services. We will wrap up the event by answering questions posed through the question and answer function in this webinar. When you submit a question, please provide your name. That way, if we don't get to your question today, we will follow up with you after the event. So our first contribution today is a pre-recorded presentation from Fighting Blindness. Fighting Blindness promotes and facilitates research into sight loss and provides support and advocacy services for those affected by sight loss.
Hello, my name is Peter Otoole and I'm the Head of Support and Counselling for Fighting Blindness. The COVID-19 health crisis presented our support service with some very significant challenges. As the majority of our ongoing support groups and our specialised interest activities were based on in-person activity, we needed to quickly come up with a solution to keep our members and our service users connected and engaged during a particularly difficult period. So despite a number of initial reservations, we adapted all of our groups to the Zoom platform. And ever since, we've doubled the number of groups that we actually facilitate on a weekly and monthly basis. The attendance at many of these has increased by over 400%, and we're now connecting with higher numbers of people throughout the entire country. We provided Zoom training to over 350 individuals, and as a consequence, we now have an active and engaged community of people coming together to learn, socialise, and support each other every week. So what I'd like to do is introduce a number of our group members today and discuss their own views on the positive outcomes of our collectively utilising new technologies to stay connected. Okay, so we have a range of people here from Sligo, Cork, Galway, Wicklow. So I'd just like to introduce Stuart, Ken, Marion and Frank. Thanks for joining us. Stuart, I'll just come to you first, maybe if you could maybe tell us about how you've used technology to avail of time with your own particular peer support group up there in the border counties.
Thank you, Peter. At the beginning, our peer group started as a group that met every week in Sligo, but thanks to Zoom, we've been able to come together over the course of the lockdown, and even expand the group to other participants in different counties they're all different ranges of ages from old to young, and they're able to attend the group without traveling, and that's one massive benefit to having it on Zoom. And it's a lot more practical.
Yeah.
You don't have to spend an hour traveling to the location. So that's what I'd say be the biggest benefit of having these meetings on Zoom.
It's a lovely mix of people, I think, from everywhere, from Louth, Monaghan, Cavan, Leitrim, Sligo, Donegal as well, which would have been a difficult
Absolutely.
Getting you all together in the same space ever before. And Ken,
Absolutely.
You facilitate the Technology Exchange Club. It's a peer technology club. Used to meet in Cork on a face-to-face basis on a Saturday morning. But likewise, maybe you could just tell us a bit how you've managed to keep things going on a weekly basis for the last 18 months.
Like you said, we used to meet at the library every week, but then when COVID hit, thanks to Fighting Blindness, they went and they purchased a license for Zoom, and since that at the start, then different staff members of Fighting Blindness, you know, brought people up to speed on how to use Zoom, and brought me up to speed on, as a facilitator, on how to use Zoom to let participants in. And like Stuart said, you know, we have a range of people from all over the country. Before, when we were at the library, you know, there might be only 2 or 3 of us some weeks at the library. Now you could be talking anything from 12 to 15 people on Zoom. And like Stuart mentioned again, they're all ages, you know, they come from all over the country. So it's been brilliant over COVID, like to keep them all, you know, keep this group going and keep people connected and resolve their tech issues every week. And yeah, we're like one big happy family, really.
That's great to hear, and I know, especially, you know, from the technology perspective, it can be a source of frustration for a lot of our service users and our members and our whole community as well. And sometimes, you know, the answer to a question about the phone or the iPad or Sky TV or whatever the question can just be a matter of asking somebody within that group. And as I know, there's a real give and take within that technology group as well, where people come and they offer to the group, and at the same time get the support from the group as well.
It's brilliant, like, and there's all different, you know, we're all different tech levels. So, you know, from beginners to someone that's really high in tech, you know, we all offer support each other the best way we can. And, you know, it's absolutely fantastic, really. It's just a lovely group to be part of.
Great, Ken. Thank you so much. Marion, I know you're a member of a number of groups as well, and I suppose maybe to ask you, what difference has using the Zoom platform in particular made to you in terms of connections and making new connections, staying connected with people you knew beforehand, and staying linked in with people in general?
Well, if it wasn't for Zoom, I don't think I'd be alive today, because it's been just fantastic. I mean, a lot of the local groups that I'd be involved with here in Galway, they're all on Zoom. So all you have to do now is come up the stairs. As Stuart was saying there's no transport involved or running out to get a bus or anything like that. But I think Fighting Blindness have played a blinder really in these hard times, bringing us all together, because I regularly link in with Connections, which is the name of the coffee morning every Tuesday morning. And now I have friends all over the country. I'm just dying to get to meet them. I have met Stuart in person. I haven't met Ken or Frank in person. So we're all looking forward to the big party that you're going to host for us, Peter.
It's coming, it's coming.
But definitely all of these platforms and the accessibility of technology. I mean, Ken would know me from linking into the tech groups, and I was just scared stiff in the beginning. I thought, oh my God, I won't be able to open my mouth. But Ken knows by now that when I start, I don't shut up. But it's just the support and the knowing that even on the coffee morning that you might have been out someplace and something would have happened, that you feel, because I personally feel a lot blinder when I'm out now than before COVID. And I suppose that is to do with being in your own surroundings for so long and just doing the same walk. I have my guide dog, so doing the same walk with him and no variation to that. I have got the courage to go into Galway City 3 times only on the bus, but you know, it's about all of us gaining our confidence back again for moving out as well, you know, that. But definitely I just hope that the Zoom will continue, yes, because that is such a great way of linking us all around the country, you know, from Sligo to Donegal to Cork, all around the place. We can link in and share our own life experience. And, you know, I might say something one day that would help another person, you know, and that has been said to me, because I'm blessed that I'm very open and honest about my own vision impairment. So I think if I can help another one get through a tough day, that's good enough for me.
That's very much appreciated, Marion. Thank you so much. And speaking of Zoom and maybe moving away from it a little bit, Frank, you're the choir master of our Visionaries choir.
Yeah, the choir has been going since 2015, so we were a long time on the go when COVID hit, and everybody knows how good singing is for your mental health, and everybody knows how bad COVID is for your mental health. So we decided, myself and Rebecca, my daughter, we're both partially sighted, but we decided that we would keep the choir going on during COVID, and we started out with Zoom, which was fine to the extent that we could everybody on Zoom could hear us. The two of us were together, obviously father and daughter. We were working together and they could all hear us, but of course they couldn't join in the singing because unfortunately Zoom doesn't work with music at all. You have to remain muted. So during the year I was researching this other app called Jamulus, which we now use in conjunction with Zoom. So we have Zoom for people who are on Zoom, and there are at the moment only about 5 people still on Zoom. And then we have the Jamulus app, which is just an audio app. There's no picture, but there's no delay, no latency, because that's the problem the Zoom has. And there's about 15 of the 16 of the choir members on Jamulus. And when you're on Jamulus, you can hear everybody else. They can all hear you. The interaction is immediate. Like between Dublin and Donegal, there might be less than half a second of a delay, which is hardly noticeable. And that's a really exciting thing because it actually will work as an outreach thing for the choir and maybe for the music school in the long run, where we'll be able to invite people from all over the country to connect in via Jamulus to their teachers who might be based in Dublin. And it's just amazing.
So many thanks to Peter, Stuart, Ken, Marion and Frank for that really terrific presentation, which positivity just shone throughout. We thought the idea of that big party was fantastic, so Cliona and I will be looking out for our invitations. That presentation really highlighted how the use of technology has enabled connections to be sustained and indeed in many cases to be extended during the pandemic. That was something that featured in many of the submissions that we received. It was also really interesting to hear about how the members of Fighting Blindness provided each other with peer-to-peer support to resolve technology issues. I would now like to welcome our next presenter, Pat Faherty, the chairperson of the Galway Advocacy Council of the Brothers of Charity Services. Pat is going to tell us about some of the innovations introduced by the Brothers of Charity Services during the pandemic, and also talk about maintaining positive mental health and attitudes. Thank you. Over to you, Pat.
Good morning, everybody. My name is Pat Faherty, and I'm here to talk to you today about my life during COVID and all. So now I'm going to just say good morning to everybody present at this meeting today. My name is Pat Faherty, and I am elected chairperson of the Galway Advocacy Council, and I would like to thank NDA for asking me to be part of their launch and congratulate them on their report. In my presentation, I have chosen 8 out of hundreds to talk to you today about. At the end of the presentation, I have put a slideshow together of many more things that happened in Galway. I hope you enjoy my presentation. So my top 8 projects that we are involved in are activity and care packaging. People supported by the services made up a care and activity package and delivered them to people in the community. Grants from COVID-19 Emergency Fund, Galway County Council, Galway Rural Development, Social Services, Galway, the Travel Movement, Food Cloud, Galway, and Accessibility Ballinasloe. The Galway Community Call Network helped deliver medication, call to people in the services for a chat, and also to reduce loneliness. Gardaí in Galway City developed a relationship with us, which was a huge benefit. And if I may add, from my personal experience, I appreciate it because they actually call me on the phone and also visit me from time to time to my house, and appreciated the 10 or 15 minutes conversation and kept me safe at all time. So That's Life is an award-winning arts personal development program. Throughout the pandemic, they organized so many events. For example, mass service, art and lip sync competitions, and we even had a disco bus which came to entertain us. Claren Rainbow Project. This project was an art. This project was started by an art teacher in the service. She got everyone in the community, both young and old, to make pictures of rainbows. A display was put up in Clarenbridge to thank everyone that worked in an essential service. Yeah. Positively Rocks project. This stone painting project hit the headlines for all the right reasons. A small group of painters left a trail of uplifting messages on stones around popular workplaces, and people loved the messages. Technology has played a very important role in the service throughout COVID. This was very new for people. Connecting online reduced isolation and loneliness for people. The service applied for many grants and now have 120 new iPads. So the online classes, technology has been used, online Zoom classes, people supported by the services engaged in classes with many organizations. And below are some examples. Art and cookery, mindfulness, mental health, stress control, music, men's shed, yoga, budgeting, nutrition, digital photography, felting classes, and woodwork sessions. Newsletters. In 2020, we produced 11 newsletters. They were used to share activities and events so people felt connected and had things to keep them busy. We also used them to send information to people in an easy read format. So my own experience living well in pandemic. During lockdown, I had to manage a few nights on my own. Grateful for the support I got from Irish Research Association and also the Brothers of Charity staff. So you might say what I did to keep me busy. There was never a dull moment. So I have two mottos: believe you can achieve and advocacy works. So now I'm going to show you the pictures. So as I say, my mottos are believe you can achieve, and the other one is advocacy
Thank you, Pat, for that really fantastic presentation. It has put a smile on my face and left me feeling happier. Your resilience and positivity are really inspiring. Pat's presentation highlighted how the Brothers of Charity Services very successfully developed and expanded connections with other organisations, and how those connections made the Brothers of Charity Services and the community stronger. This echoes a theme that came through very strongly in other submissions, that of increased collaboration within and across agencies and organisations. Our next presentation is a video compilation from the Dublin City Sports and Wellbeing Partnership and the CRC. We received a really detailed and comprehensive submission from Sports Ireland that listed over 40 different initiatives by national governing bodies, Vision Sports Ireland, CARA, Swim Ireland and Tennis Ireland, and by several local sports partnerships, sporting organisations and service providers. Today's presentation focuses on the water taster sessions that were provided by Dublin City Sports and Wellbeing Partnership. The video shows how, like many other local sport partnerships, Dublin City Sports and Wellbeing Partnership worked creatively throughout the pandemic with services like the CRC to promote participation in sport and physical exercise.
Sport and physical activity for people with additional needs is ever more so important. Individuals with additional needs would have poor mobility anyway and poor social connections.
For some people with additional needs, the opportunity to take part in sport and physical activity can lead to increased independence and increased functional outcomes.
During COVID-19 restrictions, we felt as a partnership that we had to break down those barriers and give a platform for people with additional needs to keep them healthy, happy and active. We came up with a number of ways to continue to deliver services. We engaged through online portals, either through services that we had already engaged with or creating our own online portals such as Zoom or Teams for people to engage with ourselves.
Some of the barriers that participants may have faced would have been technology and access to devices. So we made sure that things were as accessible as possible to make sure everyone had opportunities to take part.
We delivered a number of activities during COVID-19 restrictions. We would have delivered some circuit classes to different disability organisations. We engaged in delivering virtual online summer camps as well.
You know, when it all started, it was kind of like, oh, this will be a couple of weeks, and now, before we know it, it's been 15 months, and looking back on what we've actually done over the last year, it's just been an incredible amount of work.
One of the children that we had was in our Learn to Cycle programme. While he didn't exactly learn to cycle, but he had gained enough skills to be able to balance the bike and push himself along. And during COVID, he was able to go out on his bike, on his road, and participate with all the other kids. And that, for me, means more than any other number. If there's a parent or carer or somebody who supports an individual with additional needs watching this and they're unsure, pick up the phone, email us.
There's so much going on in your local area. If you just give us a shout, we can point you in the right direction.
Hello, my name is Donald O'Connor. I'm a trainer in the CRC Raheny campus. We have for you today a short video to showcase some of the water sports activities that we were invited to sample as part of the summer programme with Dublin City Sports and Wellbeing Partnership.
Hi, my name is Ross. I am 22 years old, and the thing to talk about right now is about the kayaking. I encourage young groups to try it out, and it is really good. You do get the hang of it right away. And I wasn't scared doing it. I wasn't even scared at all. I mean, I've gotten used to the sea now. And it felt easy to row. And there's also the rowing in River Liffey as well, which for starters I didn't get the hang of, but when I did the second time in the coming week, I got the hang of it, and I was quite good at it. So the best thing to do is to take part in some activity. Stay safe and try these activities.
My name is Richard Curtis. I'm 24 years old. I'm from Portmarnock in Dublin, and I'm here to tell you about my water sports. We did 2 water sports. We did kayaking in East Wall Sports Centre, and we did rowing in Chapel Lizard. It's very enjoyable. The staff there are really nice, and for the kayaking, that is very funny. We did some games like Simon Says, stand up on the boat, up on your knees, dunk your head in the water, and then the rowing, you teach us how to row the boats, and it's very nice because of this year it's been horrible with the pandemic and COVID, and nice now to get out and do all the water sports and be out with your friends and have a laugh, and then you could get out of the class for a couple of hours and just chill basically with your friends. And
last month, Dublin City Sports and Wellbeing Partnership invited a group of 6 students to try out kayaking at the East Wall Water Sports Centre. We were extremely lucky with the weather, as it was a really sunny day with no breeze blowing. Perfect conditions for kayaking. After all the COVID triage calls and paperwork were completed, we proceeded with some training on water safety and rules regarding kayaking. The kayaking instructor on the day was Alan, and he kindly showed us the basics to kayaking. We were now ready to launch our boats out into the water.
it's much cooler on the water than it's something.
Have you got wet yet? As Ross said earlier, it didn't take us long to get the hang of it. I think Alan has to take a lot of credit for this. His good humour put us all at ease. We were challenged, felt the fear, but we rose above it and conquered our fears. This is a life lesson for us all. No matter how tough it gets, we know to push on through and see things out. We are so proud of ourselves. Our positive mental attitude saw us through the difficulties on the water. We felt amazing after achieving our targets and never expected it to be so much fun. And yes, it was okay to fall in. As a matter of fact, Alan even encouraged us to do so early on. We went on to test our abilities even further as we got more comfortable with our kayaks. By working together as a team and using good communication skills with lots of encouragement, we achieved our goals. Despite being quite tired coming out of the water, everyone was still on a high, as our instructor Alan praised us for our achievements. On our programme, we often focus on the benefits of being outdoors. With these water sports tasters, we are also able to see the benefits of being out on the water. We have challenged ourselves to move out of our comfort zone. We've enjoyed the new experiences and realise how important it is for our confidence and self-esteem to try out new things.
That was pretty good today, so
yeah.
Hooray!
With the recent success by the Irish rowing Olympians in Tokyo, it's time to reflect back on our own achievements with this rowing taster in Chapel Lizard. Rowing is all about being able to follow instructions and to be able to row in unison. There's obviously a technique you have to master before you can go anywhere in a rowing boat. And with a bit of practice, we mastered that technique as well.
want to thank all the staff. I want to thank Gavin and Gareth down at the rowing for teaching us how to row. I want to thank Alan up at the kayaking for teaching us how to kayak. I want to thank Neil and Lisa for organising it. I want to thank all the staff in CTTV, Owen and Donald for bringing us down to the things and for providing it for us. So thanks lads.
So that's a wrap from us here in the CRC. Hope you enjoyed watching our video today, and special thanks once again to Dublin City Sport and Wellbeing Partnership for allowing our adults to participate in the summer water taster activities. Thanks and goodbye.
To the presentation today from Courtney McGrath. Courtney is currently working for the Trinity College Dublin Disability Services, and she's going to talk to us today about her experience of online learning and assessment.
I'm just going to share my screen. Some technical issues. But hi everyone, thank you to the National Disability Authority for the opportunity to have me speak at this event about innovation during COVID times, and congratulations on their report. So a bit about me, my name is Courtney and my pronouns are she, her, and I've recently graduated with a degree in business and sociology, and I'm currently working as a graduate intern for the Trinity Disability Service for the year. I have a disability myself, as I am profoundly deaf, and I wear bilateral cochlear implants and I rely on lip reading. I am the co-founder of the Trinitybilly Co-op, which was founded in May 2020, but I will discuss the co-op more later on in the presentation. So even though I made it to the end of my degree, I did face some challenges during my studies. So with hearing loss, I struggled to hear in lectures and engage in tutorials, which was important for studying business and sociology. This impacted my results in my first year. So the disability service for my second year onwards provided me with a note taker. I found this very helpful, as it was great that I wasn't missing out on any information, and it was also good for revision. And during COVID-19, teaching was moved online, and this had its own challenges as some platforms didn't have closed captioning, but I will discuss this more later on in the presentation. But there was also positives for having a disability in third level education. It made me realise I'm very interested in Irish Sign Language and disability activism. I was in roles such as chairperson of the Trinity Sign Language Society and also the disability officer of my students' union. So even working voluntarily in these areas had led me in the job that I'm in today with the disability service, and I love every minute of it, and I love that I'm continuing to learn about what other issues students with disabilities have in higher education. So as I mentioned, there was a shift to online learning as a result of the COVID-19 pandemic. While being online, it was not the most ideal way of finishing my degree. It also allowed for innovation to emerge, where there was a lot of assistive technology available for students with disabilities to help with studying. An app that I personally really found useful was Otoole, which was a transcription app that I can have open during lectures, and this would record what the lecturer is saying so I don't miss out on what's been said in class. So from my year and a half of online learning and hearing other students with disabilities experience of online learning, there are some pros and cons of this approach. So the positives that I found was that online learning can be a more accessible option for a student with physical disabilities, as they would not need to travel to college and they can do their classes from the comfort of their own home. So, and also some campuses mightn't be fully accessible for students with physical disabilities. Is also a safer option for immunocompromised students, as it is unsafe for students to continue with in-person learning if they're not vaccinated and when there is a risk of contracting the virus. Online learning also allows students to work at their own pace, as they can pause and rewatch lecture content to ensure they fully take in the information and understand the main concepts. This is very important for me as a student with hearing loss, but also could be important for students with dyslexia or ADHD, as they may struggle to hear and concentrate. Some of the cons of online learning is that some lecturers I found were using platforms such as Blackboard Collaborate, which did not offer closed captioning, when other platforms such as Microsoft Teams, Google Meets and Zoom have closed captioning. So that would have meant I was missing out on a good bit of content. Pre-recorded lectures can also be a source of anxiety because of lack of structure. Live lectures are more engaging for students and they can incorporate them into their college schedule. And there is also a growing concern that lecturers are not looking at or refusing to provide learning support to students with disabilities, as just because teaching's moved online doesn't mean that they don't need the supports. So there's also separate challenges and strengths to do with online assessment. So the strengths of online assessment is that online exams can allow for greater quality of work and a better understanding of the concepts being examined, as it is less based on rote learning and more focused on what you can do with what you know, which is very important for courses like myself that I did business. Some exams are 24 or 48 hours, which allows students to take a break if they needed to, which wouldn't have been possible before COVID. And having exams online, if you had a quiet home environment, would mean there's less distractions, as in-person exams, students could be moving around, handing up their exams, so it can allow for greater concentration. So some of the negatives of online learning is that if you didn't have a stable internet connection, this could increase anxiety for students if they have to miss a deadline or the internet could drop mid-exam. There will be less flexibility in the instance, as lecturers have already provided 24, 48 hours for exams, as this seems generous in comparison to in-person exams. And with the 24, 48-hour exams, there could also be an overlap, which meant that students would not get the full time to finish their exams and would be left at a disadvantage. And also students registered to the disability service could have extra time. So this, for myself, I had an extra 8 hours, and sometimes this was not put in place by lecturers, or there wasn't a separate folder for them to upload the exams, which would have caused anxiety for students. So from the being learning in person and online, my solution, I think, and what other students with disabilities would agree, is that a hybrid learning system would be a good idea going forward, as this would mean that immunocompromised students wouldn't need to put themselves at risk of going to class, and students that might find it difficult to concentrate can rewatch lectures. But giving students the option to be physically there or not is important, and could be achieved with more technology in lecture rooms, better captioning software, and lecturers being upskilled on how to use technology effectively so all students can engage in class. As I mentioned at the start of the presentation, the Trinitybilly Co-op have been working on projects to raise awareness about the issues students with disabilities face with online learning, as we had found that we were getting left behind in the decision-making process when it came to teaching and learning. So the Trinitybilly Co-op was founded in May 2020 by myself and other students with disabilities in Trinity College Dublin, with the mission to achieve radical inclusion for students with disabilities on campus. So we have been working on media campaigns to raise awareness on what it's like to be a student with disability, and we're currently working on guidelines and resources for clubs and societies in Trinity to be more inclusive to students with disabilities. And we are also working on a short film and a podcast series to also highlight the experience of what it's like to be a student with a disability. So we're currently getting ready for the next academic year, and we're excited to have more students with disabilities involved and more projects working on radical inclusion on campus. So if you would like to see any more information on the Trinitybilly Co-op, you can scan this barcode, and I'll also put, I'll leave a link in the chat if I can, so you can follow our social medias to keep up to date with the projects that we're doing. Thank you.
Really interesting presentation and well done on all the work that you've done around the Trinitybilly Co-op. It's great to see that there have been strides towards a hybrid learning model for higher education, but your presentation really highlighted that there are still issues to be addressed.